Hello, my name is Sylvia Frazier-Bowers, and I am an Associate Professor of Orthodontics at UNC Chapel Hill and the Principal Investigator of the study entitled Establishing the Diagnostic Criteria for Eruption Disorders Based on Clinical and Genetic Data. My colleagues and I have spent a fair amount of time studying a problem that presents a significant challenge for the orthodontist, both in terms of diagnosis and management. Our paper takes advantage of a combination of clinical and genetic data to form guidelines for better diagnosis and management of eruption disorders. Doctors Stephanie Rhoads and Heather Hendricks, who both contributed to different aspects of this study, will share the highlights of the study rationale and design.
The diagnosis and management of clinical eruption disorders is challenging. A common clinical dilemma is distinguishing primary failure of eruption from ankylosis, since both disorders are similar in clinical appearance. In fact, there is some evidence that PFE is often misdiagnosed as ankylosis. The objective of our study was to establish definitive criteria that will differentiate between and improve diagnosis of eruption disorders, specifically primary failure of eruption and ankylosis. Distinguishing these disorders is important in the context of ankylosis and PFE dictate distinctly different treatment modalities, and inaccurate diagnosis could significantly alter the treatment success. You may already know that the consequence of treating PFE with a continuous arch wire is intrusion of the adjacent teeth. Proper diagnosis will avoid this fate.
Realizing that the difficulty in treatment lies in the diagnosis, we sought to search for the truth in diagnosis using our database of patients with eruption disorders. The discovery that the PTH1R gene was responsible for some cases of PFE formed the basis of our strategy to analyze our eruption disorders database. We looked carefully at 27 PFE-affected patients using clinical records and PCR sequencing of PTH1R. We also characterized 46 individuals who did not undergo PCR sequencing but were clinically diagnosed with PFE, and 6 who were diagnosed with ankylosis. The major finding of our study is that 100% of PFE-affected individuals with a confirmed mutation in PTH1R had at least one affected first molar and a clear eruption pathway. These hallmark features now form the basis of diagnosis for PFE versus other eruption disorders.
So, what is the bottom line? Our study helps to establish the clinical features that define PFE and so creates a diagnostic rubric for the orthodontist, pediatric, or general dentist. This rubric is as follows. First, ask if the eruption pathway is cleared. Then ask if at least one first molar is involved. From this point, the decision tree will lead to PFE if there's a family history and/or the identification of a mutation in the PTH1R gene. If not, it will lead to ankylosis or some other eruption pathology. We hope these findings help the diagnosis and management of eruption disorders, and we will continue to refine our understanding of eruption disorders with ongoing studies at UNC.